In this video, we will go through health insurance settings and entry within Lenvo HR. The system handles health insurance with different companies, different schemes, classes, and even cost allocation. The company can handle a share and the employee can handle another share. To start with, we need to configure health insurance companies. So from settings, human resources, medical insurance, and over here I will start adding new health insurance company. So over here, health insurance company, test, I can add email, contact person name, fax number, etc. Over here, I can enter the number of forms that are given to the employee per year. However, if your company does not manage count of forms, no need to enter any number and keep it as 0. Start date, based on the contract, we place the start date and the end date in case it's applicable. Also, we have to set if it's active, yes or no. Depend on working days. This will allow the system to calculate the cost of the health insurance based on the recruiting date and allocate the share, the employee share, according to working days. Other notes, etc. Then we click Save. Now we have the insurance company. Inside it, we have a new tab opened that allows the user to add schemes. We'll start with a new scheme. So it could be Class A insurance. I select the company, whether it's active, if it's calculated annually, yes or no, and if I have any other details. We'll click Save. And again, go inside to add scheme details. Start with new. Over here, I have the employee himself, the spouse, children, father, mother, and other relatives. So we'll start with the employee himself or herself. Coverage, the health insurance coverage, 100%. Annual cost, we can select the annual cost based on the contract. If we have any issue fees for the health insurance, we can add it over here. As for the employee within the company, you can have a share that is covered 100% by the company. So the employee share will be 0. Over here we enter the shares in case some claims were added for health insurance and they were not covered. Usually it would be the same. We can also base the share of the employee on the salary, not on the cost. However, for our example, we will keep it based on the cost. We click Save. So now we have the first dependence type, which is the employee himself. Then we click New, Spouse, Coverage, let's say 100%. Annual cost, it could be the same. it could be the same, and the company share could be 80% only and 20% for the employee. By clicking Save, we insert the spouse. Again, we can add first child coverage 100%. It could be 80. And then the annual cost. Let's put a different cost. Company share is 50% for this example and 50% for the employee. The same applies for the uncovered. Usually the uncovered is C0 on the company and 100% on the employee. Over here I can add the count of children that will be covered. However, some of these schemes are subject to age groups. So I can identify these schemes based on age groups. So again, dependent. So from 18 till 60, the annual cost, and I can add maximum deduction amount per month, and I can add issue fees. I can add age groups, and the cost could differ based on the age groups. So from 18 till 60, this is the cost. By entering maximum amount of deduction 0, then that means there is no limit. Clicking Save will add this group. This is very handy for children because some of the companies, they do not insure children above 18 years old. For this example, we will not do age groups, and we will go, after doing the configuration for the health insurance schemes, now we are ready to add employees to different schemes. So this is class A. I can add another class, which is class B. And then I have to do the same again and again and again. We'll not add this, and we'll go and start linking employees to the health insurance. I go to the employee's profile. Under personal info, family members. Before starting the health insurance, I have to add family members if applicable. And under the contracting, I will see health insurance. Over here, I can link the employee to a health insurance scheme. So let's link this employee by clicking New. As we can see, we have all the insurance companies and the insurance schemes and the start date. So from the beginning of the month, we have the employee coverage, share, etc., 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 etc. I can enter card number and policy number, and the start and end date is calculated automatically. You can enter over here notes. Over here, the spouse, if I entered a spouse in the family members, I will see them over here and will apply the rest. So for our example, before we start adding the health insurance, I want to add a spouse only. New. Name of the spouse. date of birth, so we can do age groups, so this is required, so the system can calculate age groups if applicable, and effective dates, since when is active, relationship, spouse, document number for national ID, sorry, this is document number, and this is the national ID, expiry date, gender, mobile number, email, marital status, if there is other information. I will click save, and now we have under the family member the spouse. Under contracting, health insurance, new. So now over here I can select the spouse, enter card, and again enter start date. For a whole year. Now click save. So now this employee is linked to health insurance scheme. This will have its effect and impact on salary calculation. We will see the effect of health insurance on payroll calculation. So for February 2022, for employee number 10, we do the calculation of the salaries and we generate the salary slip. Over here, as we can see, the employee share is calculated by the system. How was it calculated? So going back to the settings and doing the math, so the cost of the health insurance is 545 divided by 12 months multiplied by 20%, which is the share of the employee. As we can see, the numbers match.